Fibromyalgia is a condition that can cause constant pain. Often it's a problem without a clear cause and can be difficult for doctors to diagnose. The syndrome affects millions of Americans, mostly women, and as Lurene Cachola explains, some people can suffer for years without knowing exactly why.
Beth Turner takes antidepressant medication every day, not because of depression, but to manage chronic pain. She's one of the 5 million Americans suffering from fibromyalgia.
Fibromyalgia is a chronic, widespread pain condition where patients report pain all over their body. It's thought to result from an increase in pain processing in the central nervous system. So to put it simply, it's like the volume control on pain has been turned way up, so that something as simple as a hug can be painful for patients.
Turner, who is a nurse by training, is currently the administrative director of the Women's Health Center at Baptist Memorial Hospital. She began noticing symptoms 13 or 14 years ago when she was working as a night shift nurse and raising 2 young sons.
The onset was fatigue and sleeping problems. And then I think as a result of the fatigue and the problems sleeping, I began having palpitations.
The doctor she had at the time looked at her heart. He ruled out heart problems and diagnosed panic disorder and put her on antidepressants. That helped, even though she didn't think she was having panic attacks. In addition, she used heating pads, blankets, and cushions to manage her condition for years, not knowing exactly what it really was. The diagnosis that it was fibromyalgia only came a year and a half ago, after a marathon work session to build and move into the new Women's Center. She worked 10 to 12 hours a day and for 26 days straight. After the center opened, she hit the wall.
That's what I call it when it happens. I just hit the wall and I wound up in the bed for about 4 days. During that time, I went back to my primary care physician, and of course, and actually she's excellent, and based on a very detailed history that she had taken the time to do, she began wondering if fibromyalgia might be my issue.
She takes a low dose of antidepressant daily and a prescription-strength pain reliever on bad days. Her symptoms include occasional cognitive problems, what's called fibrofog. The diagnosis also clarified the pain in her back and hip, a couple of the body's 18 tender points, areas that are extremely sensitive to the touch in people with fibromyalgia.
But I can just be more proactive with what I'm doing, like exercise, getting on the treadmill, just knowing that, okay, we've got weather coming in tomorrow, so I better get on the treadmill tonight before I go to bed. That will help. So those sorts of things. I think it's been much better just knowing that I'm not, crazy coming up with all these symptoms.
Turner calls herself a walking barometer because the onset of pain means cold and wet conditions are approaching. She takes extra precautions during bad weather and uses massage and chiropractic treatments to manage the pain, along with the sound machine to help her sleep. For Turner, solving her fibromyalgia puzzle got easier once she knew she was finally able to put the pieces together. For Smart Medicine, I'm Lurene Cachola.